Why healthy people can still have high blood pressure. Many patients with elevated blood pressure feel confused because they appear to be doing everything correctly. They maintain a balanced diet, exercise regularly, avoid smoking, limit alcohol, and reduce salt intake.
Despite these efforts, their blood pressure readings remain consistently high. Clinically, this situation is common and reflects an important medical reality. Blood pressure regulation is influenced not only by lifestyle habits, but also by complex internal hormonal signals. One of the most overlooked factors in blood pressure physiology is the role of insulin.
Insulin is widely known for regulating blood glucose,
but it also plays a significant role in cardiovascular and renal function.
When insulin levels rise, several physiological responses occur simultaneously.
The kidneys are signaled to retain sodium. The sympathetic nervous system becomes mildly activated, and blood vessels are less likely to fully relax.
These responses are normal in the short term, particularly after meals.
However, when insulin levels remain chronically elevated, these mechanisms begin to contribute to persistent hypertension. Under normal metabolic conditions, insulin rises after eating and gradually returns to baseline.
This cycle allows the body to regulate energy and maintain hormonal balance.
Problems arise when insulin does not return to baseline because eating occurs too frequently.
Many individuals consume food multiple times throughout the day.
Breakfast, snacks, lunch, additional snacks, dinner, and sometimes late-night food.
Even when these foods are considered healthy, each eating event stimulates insulin release.
When meals and snacks are closely spaced, insulin remains elevated for most of the day.
Persistent insulin elevation has direct consequences for blood pressure regulation.
The kidneys play a central role in controlling fluid balance and sodium excretion. However, kidney function is heavily influenced by hormonal signals.
When insulin remains elevated, the kidneys interpret this as a signal to conserve sodium.
As sodium retention increases, blood volume gradually expands, which contributes to higher blood pressure levels.
Importantly, this process can occur even in individuals who significantly reduce their dietary salt intake. This mechanism helps explain why some patients see little improvement in blood pressure despite aggressive sodium restriction.
The issue may not be the amount of sodium entering the body, but rather the body's reduced ability to eliminate it due to persistent hormonal signaling.
Another factor that complicates this picture is metabolic health in individuals who appear physically fit. Body weight alone does not always reflect metabolic status.
Some individuals with normal weight accumulate higher levels of visceral fat.
The type of fat stored around internal organs, such as the liver.
Unlike subcutaneous fat, visceral fat is metabolically active and contributes to insulin resistance.
When insulin resistance develops, the pancreas compensates by producing more insulin to maintain normal blood glucose levels.
Laboratory glucose tests may remain within the normal range, yet circulating insulin stays chronically elevated.
This condition is often clinically silent, but can influence several physiological systems, including blood pressure regulation. Chronic insulin elevation promotes sodium retention, increases sympathetic nervous system activity, and reduces vascular relaxation.
Together, these effects create a sustained upward pressure on blood pressure levels throughout the day.
Certain lifestyle patterns further reinforce this hormonal state.
Frequent snacking or grazing throughout the day prevents insulin from returning to baseline.
Liquid calories such as smoothies, juices, and protein shakes are absorbed rapidly and can produce quick insulin spikes.
Late-night eating may also contribute significantly to hypertension by keeping insulin levels elevated overnight.
It's a period when the body normally performs metabolic recovery and cardiovascular regulation.
From a physiological perspective, one of the most effective strategies for improving this hormonal pattern
is allowing periods during the day when insulin can naturally decline.
This does not require extreme dietary interventions.
Instead, simple structural changes in eating patterns may help restore metabolic balance.
Examples include reducing unnecessary snacking, spacing meals appropriately, avoiding late-night eating,
and limiting daily food intake to a consistent time window. When insulin levels are allowed to fall, several beneficial changes occur. The kidneys resume normal sodium excretion, blood volume stabilizes, the sympathetic nervous system becomes less active,
and blood vessels regain their ability to relax.
As these systems normalize, blood pressure levels often begin to improve.
From a medical standpoint, persistent high blood pressure should not be viewed solely as a failure of lifestyle discipline.
In many cases,
It reflects underlying metabolic signaling that has been quietly influencing cardiovascular physiology for years.
Understanding these mechanisms helps explain why otherwise healthy individuals can still develop hypertension.
And highlights the importance of addressing metabolic health alongside traditional lifestyle recommendations.
Thank you for watching.